Looking at a couple internal features of the heart, we're going to start with two traits of the fetal heart. The fetal heart contains a temporary vascular channel called the ductus arteriosus that you see in the picture here that connects the pulmonary trunk and aorta. If you notice, the pulmonary trunk has oxygen-poor blood, whereas the aorta has rich blood, and some of that blood can be shunted from the pulmonary trunk to the aorta. It is rerouted because the fetus gets the oxygen from the mother, not from the lungs. So this obviously has to close off and change after the fetus is born, and it becomes the ligamentum arteriosum, which you can see connects the pulmonary trunk and aorta in our other figures. So it's the ductus arteriosus in the fetal heart, the ligamentum arteriosum after the fetus. There's also a very similar structure called the foramen ovale that will also allow the passage of oxygen-poor and oxygen-rich blood between the right and the left atrium. This is in the interatrial septum, which is the wall of the myocardium that separates the right and left atrium. So the foramen ovale is there in the fetus, but this seals off after birth, forming a little indentation called the fossa ovalis. So the same reasoning for the ligamentum arteriosum is the foramen ovale. We're going to look at some other internal features of the heart, and most of these are going to be related to heart valves. So when we look on the inside of our atria, you have these muscles that look like honeycombs called the pectinate muscles. And if you notice, they are labeled there on the inner wall of the right atrium, and this is where you can best see those honeycomb-like pectinate muscles. Because the atria are smaller and thin-walled and only have to push blood down into the ventricles beneath them, the muscle in the atria is going to be less pronounced than the muscle in the ventricles. We can see the ventricular muscle labeled there in the left ventricle, and those big muscle ridges in the ventricles are called trabeculae carni. So they're called pectinate muscles in the atria and trabeculae carni in the ventricles. Coming off of the trabeculae carni, there are some finger-like muscles known as papillary muscles, and you can see a papillary muscle labeled in the figure with an arrow there. Those papillary muscles are designed especially to work with atrioventricular valves, and there are 4 valves in the heart and 2 types. The 2 types of valves are semilunar valves and atrioventricular valves, and atrioventricular valves, like they sound, are located between the atria and the ventricles. And all the papillary muscles, like you see here, are attached to valves. So we're going to look at those valves. Those valves attach to tendinous strands known as chordae tendineae. And if we go back to this figure, you can see my mouse running along the chordae tendineae attached to the papillary muscle. Coming off of the chordae tendineae is tissue called cusps. Now the valve on the right side of the heart has 3 structures like this, so 3 cusps attached to chordae tendineae attached to a papillary muscle, and that valve, therefore, between the right atrium and the right ventricle is called the tricuspid valve because it has 3 cusps. On the left side of the heart, between the left atrium and the left ventricle, you only have 2 cusps attached to chordae tendineae and papillary muscles, so it is known as the bicuspid valve. And what these do is they prevent the valve from opening backward, and we can notice that when the ventricular muscle is relaxed, the chordae tendineae are slacked and the valve is open, so blood can easily come through those atrioventricular valves. However, whenever the muscle in the ventricle is contracted and those papillary muscles contract, the chordae tendineae are pulled taut, it pulls those cusps together, and as you see with the red arrow, blood cannot go back into the atria from which they were just discharged. So those valves are very important in promoting the one-way flow of blood through the heart, so they can't go back from the chamber that it just came from. So pictured here is the bicuspid valve because it has 2 cusps. The tricuspid would have 3. So we said those 2 atrioventricular valves, the bicuspid and tricuspid, are located between the atria and ventricles. The other 2 valves are of a type called the semilunar valve, and the semilunar valves are less complex in structure. Both the atrioventricular and the semilunar valves open and close in response to changes in pressure to promote the one-way flow of blood through the heart. So we see here all the valves labeled. It's a little bit harder to see the structure of the pulmonary and aortic valve. So your 2 semilunar valves you see pictured here at the top are the aortic semilunar valve, which is located between the left ventricle and the aorta, and the pulmonary valve, which is located between the right ventricle and the pulmonary trunk. The pulmonary valve promotes prevents blood flow from coming back from the pulmonary trunk into the right ventricle that just discharged it. The aortic valve prevents blood flow back into the left ventricle from which discharged it from the aorta. So they are a little bit more simple. They have infoldings of the inside endocardium. They do not contain papillary muscles and chordae tendineae. So semilunar valves open with ventricular contraction and close with ventricular relaxation. So we can see here from the outside, those surface features, you're not able to see those valves from that region. So valve function review, if we ask ourselves, if you pause the video really quickly, which side here do you see is the anterior surface of the heart, and how do you know? So pause and ask yourself that question. The anterior surface of the heart is here right under valve function review where I'm running my mouse, because we see the pulmonary semilunar valve. And we saw earlier in the great vessels that the pulmonary trunk was the most anterior vessel. The pulmonary valve is located in the anterior trunk between the right ventricle and the pulmonary trunk. Looking at the same image, what are the ventricles doing in this first image that I'm circling my mouse around? So in this first image, the semilunar valves, the pulmonary valve and aortic valve, are closed, but the atrioventricular valves, the bicuspid and the tricuspid, are open. So think about it. Are the ventricles contracting or relaxing? So pause the video and ask yourself, are the ventricles contracting or relaxing in that figure? So here, the atrioventricular valves are open, and that means that the ventricles are relaxed and the atria are contracting. Atria and ventricles contract and relax opposite of one another. So when the atria are contracting, the ventricles are relaxing. When the atria are relaxing, the ventricles are contracting. When the atria contract, they push blood down into the ventricles, so these atrioventricular valves have to be open. Because the ventricles need to fill, the semilunar valves are closed. Here in the second figure, we see the opposite. In the second figure, the atria are relaxing and the ventricles are contracting. We know this because the bicuspid and tricuspid, the atrioventricular valves, are closed. It's preventing blood from going back into the atria while the ventricles are contracting, and the ventricles are contracting to push blood into the pulmonary trunk on the right side of the heart and the aorta on the left side of the heart. So the pulmonary semilunar valve and the aortic semilunar valve are both open. So we'll see that we have the systemic and pulmonary circuits, and those valves promote that one-way flow of blood through the heart.